Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us, and we are very honored, we have Carmen Lewis. She is a registered nurse and a stroke navigator, and also has a plethora of different um, expertise and certifications. And then we have Sarah Christie, and she is the stroke program coordinator and also a registered nurse and a plethora of certifications and expertise. We are very honored to have them with us here tonight. So welcome, Carmen and Sarah.
Thank you very much, Elizabeth, for that warm welcome, and greetings, everyone. I'm so glad that you could join us tonight. My name is Sarah Christie. I am the stroke coordinator, as Elizabeth mentioned. I work at Virginia Mason Franciscan Health. I'm also a registered nurse. And you're probably thinking, well, what is a stroke coordinator? And what we do is we ensure that we are giving high quality care to our stroke patients when they're in the hospital. And by doing so, we look at evidence-based practice and clinical practice guidelines that are the most current and incorporate that in the care that we provide. And I help facilitate stroke care within the hospital, but also provide follow-up post-discharge. And another thing that we really enjoy in our role is spreading stroke awareness and education to our community, because that helps prevent strokes from occurring if we can get people to recognize their risk factors and other things such as that. I'm also happy to announce that this week on October 29th, it is World Stroke Day. So it couldn't be better timing to be talking about stroke awareness with you all. With that, I would also like to introduce to you my partner, Carmen Lewis. Carmen.
Good evening. Thank you, Sarah, for that introduction. And I will just introduce my role. I'm Carmen Lewis, and I'm a stroke navigator for Virginia Mason Franciscan Health Stroke Program. And I'm a regional stroke navigator. What that means is that I follow patients throughout our 7 hospitals within the system in our Pacific Northwest region. And my role differs a little bit than the coordinator role, which Sarah is. And my role is different in that I'm really focusing on the progression of care for patients when they come into the hospital with a stroke. And so I'm really building relationships with the family, with the patient. And also I have a really big focus of post-discharge support. I host a stroke support group, and I've been doing that for 3 years. We are doing it on Zoom as well. So if you're interested, please feel free to reach out. But my focus is heavily on post-discharge follow-up, support, and resources. Thank you, Sarah.
And with that, we have a great team that works together cohesively to take care of our patients in the hospital and outside of the hospital in our community. So let's go ahead and get started. So this is going to be a little interactive this evening. We want to find out more about what you know about strokes. Would anyone like to share, if they're comfortable, in the chat box, or go ahead and mute yourself on what you think a stroke is? And what do you know about stroke?
Hi, I think it's when there's not enough oxygen getting to the brain.
Absolutely. Thank you, Jennifer. You're absolutely right. So there's not enough blood flow and oxygen getting to your brain, and we need that in order for our brain to function. What percentage of strokes do you think are preventable? And take a wild guess. I don't expect anyone to know this, but it's actually an impressive percentage.
Sarah, in our chat, we have and forgive me if I'm pronouncing the name incorrectly, but Sherol did say cerebrovascular accident in response to the question about stroke. So that's really good.
Really good,
And-
thank you.
And also in response to the percentage question, Marlene's market is saying 85%. And Sherol is also coming in and saying 70%.
Wow, we have an impressive audience this evening. It actually lands somewhere between those two percentages. So roughly about 80% of strokes are preventable. So that is kind of our emphasis this evening, is talking about reducing risk factors, looking at what a stroke is and how to identify it, so that if you are, or someone you know is having a stroke, you get to the hospital as soon as possible. Thank you for participating in those questions. So what is a stroke? Well, you pretty much answered it. So it's a brain attack. It's when you're not getting enough nutrients to your brain, and those nutrients are blood and oxygen. And when that happens, brain cells can start to die, and they can die at a rate of 1.9 million per minute. So that's pretty significant. And then every year in the US, about 795,000 people experience a stroke. So that's definitely not a minuscule number. And then 25% of those are repeat strokes. So for people that maybe have had a stroke in the past, or they've had a what we call a TIA, transient ischemic attack, they might go on to have a future stroke, and we'll talk more about that. It is a number 5 cause of death and leading cause of disability in the United States. So, you know, people can have a stroke, but then they're left with that disability that can affect them long term, and we really want to mitigate that. So there are two main types of stroke, and sometimes people might think that, well, you're not getting enough blood flow to your brain because of a clot, but it can also be caused by a bleed. So to break that down a little further, is we have two categories, the kind of big words, but ischemic stroke. So that accounts for 87% of all strokes. And that is where you are not getting enough blood flow to the brain due to either a fatty deposit, plaque, or a blood clot is getting stuck in that artery. And then the blood flow is blocked, therefore leading to brain cell death at a rapid rate. Then we have hemorrhagic strokes, which is the bleeding stroke. And that's when the vessel becomes weak or leaks or ruptures, and it can bleed into your brain. So it's important to know that there are two different types, but ultimately, both of them, you're not getting enough blood flow to the brain one way or another. It's just being, it's not being routed to the right area. So what is a transient ischemic attack? Well, a transient ischemic attack is similar to an ischemic stroke, where it's the clot type of stroke presentation. So you'll have stroke-like symptoms that are similar to that, and we'll talk more about what those symptoms might look like. However, what's different with the TIA is that it's going to resolve within 24 hours. Sometimes people can have it resolve within 10 minutes, or it can resolve within that 24-hour range. Around 1/3 of all people who have a TIA go on to have a severe stroke within the first year. So even though you've had this TIA and your symptoms resolve, we still take it seriously, because it's your body's way of saying that there's a warning sign going on. There could be a potential pending stroke. So we have you still come into the hospital, and we do a full workup to ensure that your lab work is correct, your imaging, we're getting imaging of your brain and your vessels, looking at your heart and finding all sources that could have contributed to this. After a TIA resolves, you are at high risk of developing a stroke for up to 72 hours. So sometimes people will come in the hospital and be monitored for a certain period of time. So what we'll do is we'll do that full workup and do some neurological assessments on a frequent basis just to make sure that you are okay. So what is going on when a TIA happens in your brain? Well, if you look at the image below here, a transient ischemic attack, there is a clot, or it could be some lodged plaque that breaks off in your artery and it gets stuck. And your body, whether it be, your blood pressure raises and it will help break down that clot and move it forward, or it can break on its own. And then your symptoms resolve because you're getting that blood flow back. So that can happen with a TIA and why it might resolve. But with an ischemic stroke, that is permanently, that clot is not going anywhere. And so you're not going to have blood flow, and therefore you're not going to have normal function of your brain. And if you guys have any questions on the slides that we're discussing, please pipe in. All right, so now we're going to talk about signs and symptoms of a stroke. So we're going to do a knowledge check. Can you tell me what the acronym B.E.F.A.S.T stands for in stroke recognition? And if you don't know all of them, you can just drop in the box what you think each letter stands for. Don't be shy. When you think of someone having a stroke, what do you think they might look like? Yes, so I see some answers in the comment box. So question about face. So F might stand for face, S for speech, and that's absolutely right. So in the past, we've used the acronym FAST to help identify a stroke, but in recent years, we've added the B to B.E.F.A.S.T. And the reason for that is B of B.E.F.A.S.T helps identify posterior strokes. So let's go ahead and run through what B.E.F.A.S.T stands for. So B.E.F.A.S.T stands for, oh, perfect. I got some more answers in the comment box. So balance. B is for balance. E is for eyes. F is for facial droop. A is for arm weakness. S is for slurred speech. And T is time. Call 911. And I like to also say that T is for terrible headache, because if you're experiencing a hemorrhagic stroke, which is the bleeding type of stroke, blood on your brain can be very irritating. So you're going to have a really bad headache. And the key in identifying a stroke is its sudden onset. So we want, you to know, hey, this is not my normal. This happened all of a sudden. I'm having these type of symptoms, and that would prompt you to call 911. So what is going on when a stroke occurs? Well, like we talked about, your brain isn't getting enough blood flow to that region of your brain, so therefore it's becoming injured, and it can affect functions like speech, movement, vision, sensation, swallowing, memory. Your brain does a plethora of things to help you function in everyday life, and you don't even realize it sometimes. It's just automatic, but your brain does so much. It's also important to know that if you are experiencing a stroke on your right side, so the right side of your brain, it most likely will affect the opposite side of your body. So if you're starting to have some left arm weakness, a lot of times the stroke is occurring on the opposite side of your brain. And
sure, absolutely.
Oh.
Okay, here I go. Hang on. Let me just clear my.
Sorry about that. She really was wanting to pipe in. So with hemorrhagic, like I said, it could be the worst headache of your life, and you might have some visual impairment too. So that's something to important to note. So when it comes to identifying a stroke, the reason we put fast in there is because we want you to be fast. We want you to get to the hospital as soon as you can, and we'll talk more in just a moment why. So it goes without mention that stroke risk factors for women can be slightly different from men. So what we like to share with you is that women might present a little differently than men. And same goes with if someone's experiencing a heart attack. Women can also present a little differently. So just take a look over this chart here and see how women can have some generalized weakness, disorientation, fatigue, nausea and vomiting, and that could mean that they're having a stroke, where more common symptoms with men might be your positive FAST, which is the face, arms, speech. They might have some vision problems, trouble walking, or severe headache. So these are just some kind of more frequent common within the gender, but that doesn't mean that they're not interchangeable. It's good to note that 60% of stroke deaths are women, so women tend to be a little higher at risk for strokes. In fact, 1 in 5 women have a stroke. And I think the reason being is just women are more likely to have subtle signs at times. And, you know, we're trying to wash the dishes, run the errands, take care of the kids, and we're trying to brush off those symptoms. And it's incredibly important to not do that. To take care of yourself and recognize that. All right, another knowledge check here. Why do we call 911 instead of driving ourselves to the hospital? Do you think that you can get to the hospital faster than an ambulance? Probably not with all those sirens and lights, right? But that's not really the only reason for not calling 911. There's certain types of treatments that we can only give you within a certain amount of time. And we also want to make sure that you're not having a severe stroke that needs immediate intervention. So that's what a couple reasons of why it's important.
And Sarah, in the chat, there is a comment that somebody said there's a possibility of maybe having another stroke. And I think that kind of touches on maybe you're having a severe stroke, and that would be a really important reason that you should not drive.
No, that's an absolutely excellent point. And I'm glad you brought that up because especially if you're going to drive yourself to the hospital, you're putting yourself at danger and others at danger. You might think, well, I'm having a mild stroke or I had a TIA, but like you said, that stroke could come back because TIAs, they can come and go, or your stroke could be getting worse. So we definitely don't want you driving yourself, and we highly recommend just calling 911. And I know family, you know, is helpful and they might want to drive you to the hospital, but the best is to come by ambulance. And by coming by ambulance, they're giving us pre-notification at our hospitals so that we can get our team together. And as soon as you get into the door, we can do quick workup for you and address those things. It really helps out the hospital to have that advance notice from our EMS personnel.
And Sarah, I'd like to just add something when it comes to calling 911, as far as it can be with what I've even experienced is sometimes culturally, sometimes certain people, they don't want to call 911 because they don't want to be a burden, or there's other reasons that people have shared with us. But even in my own experience, it's kind of like there's kind of a shame factor to calling 911 instead of just, you know, powering through whatever symptoms that you're feeling. And so sometimes that can be really difficult to encourage our family members. No, we need to call 911 and not drive or not ignore the symptoms. And so having those conversations with the family and having that conversation ahead of time is so important, because that could prepare anyone in the family for if an emergency were to happen. But a lot of times there are some cultural differences to feeling comfortable with calling 911. So I just wanted to share that.
Yeah, no, thank you so much. It's good and important to be sensitive to those things and be aware of those barriers. Also, another barrier could be, I'm afraid of the medical bill that I'll receive from the transportation. And we've talked to, ambulance, and they say, a lot of times it's covered by insurance because it's a medical emergency. So if you're ever questioning that, you can always reach out to your insurance carrier as well. And I'm sure that there are ways to cover the costs, but like Carmen mentioned, I mean, don't minimize it. And, it's easy to say, well, I don't need it, but what if it was someone you loved and you cared about and you think that they're having a stroke? You would absolutely want them to call 911. Another area is we don't, want you to minimize your symptoms and brush them off. A lot of times when people are having strokes, I've heard them say that they felt off. They didn't feel good or like themselves. And not only that, sometimes people don't realize they're having a stroke when they're actually having it. So it's also important for people to identify a stroke in another person because they can help call 911 and recognize those things. And that's why it's important. We may not be having strokes ourselves, but it's important that, within the community, we can identify that and get help for them as soon as possible. So earlier I talked about it's important to come to the hospital as soon as possible because we have treatments that are available within a certain time frame. So if you don't come to hospital in a certain amount of time, you may not be eligible for certain treatments that can help your stroke. And so this is important for people to know, especially if you're thinking, well, I'll just wait, maybe a few hours and see if it goes away. So let's talk about those treatments. So one of the treatments is an IV thrombolytic, and that's a fancy word for clot buster medication. So what it does is it breaks up that clot, that fibrin, so that your blood flow can be restored. So with an IV thrombolytic, that is safe to do so within 4.5 hours of your last known well. So you really need to know when it was the last time you were known to be well. And, you could tell us that, or one of your loved ones or a witness could tell us that. So as you can see, it's kind of a smaller window of time to be eligible for that medication. And then also there's another treatment option called a thrombectomy. And this is where they go in and retrieve a clot. And you can see on the illustration down below, they will go ahead and go through your groin and puncture an artery, and they'll go all the way up to your brain. And they have this mesh wire, and it will go through, it will pierce through the clot and then expand and then pull that clot out. And it's really good at pulling out big clots. And a lot of times those big clots are harder to break down. So this is a very effective method. And it can be done if your last known well was up to 24 hours. So luckily, you have this additional treatment option if your clot is big enough in a certain location. And so sometimes people wake up and they've had stroke-like symptoms. They woke up and we don't know their last known well. They might still be eligible for this treatment. So this was a great medical advancement when this became available. Any questions so far? Okay, we'll move forward. So let's talk about, so that was the treatment options for our ischemic strokes where we have the clot. But let's talk briefly about the hemorrhagic bleed stroke interventions. So if it's significant enough, they could do a surgical evacuation where a neurosurgeon will go in, they'll remove part of your scalp and go ahead and extract that blood from your brain. Because if you have extra blood and swelling in your brain, there's not a lot of room for it to go. So surgically, they remove a little bit of a bone flap, remove that excess fluid and blood. It'll allow your brain to have some additional space and swelling, and then eventually it will go down, but it really needs that extra space. Because if we don't give you that extra space, the pressure and the swelling could go down, and we don't want it to go down in your brainstem because that would be bad. So that a lot of times surgical evacuation is for those really significant bleeds that are not doing well. And so the next one is if you have an aneurysm. If you want to look at the illustration below here, an aneurysm is you kind of have this weakened pocket, and we can clip it, we can coil it. There's all sorts of methods to help prevent bleeding from that ruptured aneurysm, or to fill that that aneurysm to prevent a bleed. And then that is about it for our hemorrhagic bleed strokes for the treatments. There's also medications that can help manage the hemorrhagic bleed stroke. Any questions with this one? Okay. All right, and with that, I'm gonna hand it over to Carmen to talk about risk factors.
Thank you, Sarah. And just to clarify, are you willing to keep your slides up and then we can
Yes,
go through them?
and you have remote control.
Great, thank you so much. Well, thank you, Sarah, for all of that very informative information about treatments for strokes, different types of strokes. And what I'm going to talk a lot about is how we can prevent having a stroke. And so the really big piece to prevention is understanding and knowing your risk factors. Oops, let's see. I actually want to go back one. Do you mind clicking back, Sarah? Oh, perfect. Thank you. So we are going to talk about managing risk factors. And the first set of risk factors I am going to talk about are what we call non-modifiable risk factors. And what that means is these are things that we just cannot change. They're inevitable, and it's just part of life. But it's still very important that we are aware of them, because that does add little higher stroke, because our bodies are aging, our arteries, depending on our blood pressure management, but age is a risk factor we cannot change.
Uh-oh. I think we might be having a connection.
Chance that you also having that conversation. Oh, okay. Just testing out. Can you hear me?
It's just,
Yes,
go ahead.
we can hear you again. Yay. Well, I think she's reconnecting her audio here, so we're gonna get her back
Okay, I can go ahead and finish the slide and tell Carmen. Oh, there she is.
There she is. Yay, Carmen.
Sorry about that, everyone. Just happened out of nowhere. It's a little technical difficulty. But
No worries.
we will continue on with this conversation. So I was mentioning hereditary, and if you're aware of your mother or father having a stroke, that's something to consider. Also race. So there are some researches that have shared that different ethnicities, different races are a little bit higher risk for having a stroke. And I'm wondering, really just wondering if anyone had any thoughts to maybe why some of the races that are listed there on the screen, African American, Hispanic, and also Latinos, why they might be at a little bit higher risk. And if you want to throw that in the chat while I'm continuing on, please feel free to share. But I think that's something kind of going back to culture that's really important to kind of understand. But also gender. Men have a higher risk with having ischemic strokes, and then women have a higher risk of having a hemorrhagic stroke. And also, if you've ever had a stroke or a heart attack, or even the TIA, which Sarah talked about as the warning sign, then that puts you at risk for having a stroke. So these are things that we cannot change, but we should be aware of. And I did just want to touch on the kind of the question going back to race. One thing that you could consider is, and even me being Filipino, in my race and in my culture, we eat a lot of foods that really are just high in sodium content. And also in research, there has been just in our genetics that also in African American, Hispanic, and Latinos, it is also genetic. So those are things in our genes that we just cannot change. And so that's why it's just very important just to be aware and consider that. Sarah, do you mind clicking for me? Because it's not moving forward. Thank you so much. So managing risk factors when it comes to modifiable risk factors, and modifiable meaning these are things that we can change. These are things that we can be aware of, but also we have control over. And so the number one thing that we want to be aware of is our blood pressure. And that's why it's highlighted and it's at the very top in red, because it's so important. So high blood pressure is, by the American Heart Association, considered greater than 140/90, but actually a lot of the research right now is really saying our blood pressure should be really at that 130 mark. So when you get your blood pressure taken at the doctor's office and you see those two numbers pop up, you see the top number and then the line and then the bottom number, we want that top number really less than 130 and the bottom number less than 90. And we'll talk a little bit more about blood pressure, but I just wanted to note that's what high blood pressure would be, anything above that. High cholesterol, and cholesterol is just another fancy word for fat. And Sarah kind of showed some examples of how fat can get kind of clogged in the arteries. And I always think of it kind of as like a traffic jam. So the fat gets clogged in the artery and it causes like a major traffic jam. But that's why having high cholesterol can be very dangerous, as she showed. Smoking can be a risk factor, diabetes. And one of the big things about diabetes is that the sugar just really tears away at the arteries over time. So it's just kind of like sandpaper in your arteries, and it weakens your arteries. It puts you at risk for breakage of of blood that's going to break off. It's also going to weaken the arteries, and so they can tear and potentially cause a hemorrhagic stroke. So that's why diabetes is so important, that it's managed, and you talk to your providers about keeping your HbA1c, which is the blood level they check, keeping that within range, and even trying to lower it with a modified diet. Obesity, and so we've probably heard of a BMI, body mass index, and it's technically over 30, but really it's important to talk to your provider, talk to your doctor about what's healthy for your weight, what's healthy for you. And it's kind of hard to figure out the BMI, but I think for what I would say is really talk to your doctor about what's healthy for your age, for your weight, and for your height, kind of all of that factoring in. So carotid and artery disease. So Sarah showed some really cool pictures of the arteries, and those are in our brain. And that's what kind of passes all that blood flow through our brain and in our neck, and then in the back of the brain and all throughout. And it gets really fancy in there. But when we have buildup of any plaque or anywhere within the areas of those arteries, that can really decrease the blood flow to your brain, because there's kind of a blockage. And so that's a risk factor, especially if you've got any cardiac history when it comes, we mentioned heart attacks. So keeping that in mind, those can kind of play together. An inactive lifestyle. And what does that even mean, right? What is inactive lifestyle? Well, American Heart Association recommends at least 20 minutes a day for being active. And what does being active even mean? Does being active mean we have to go to the gym every single day and lift weights? No, it doesn't mean we have to go to the gym, but being active can be walking fast in place. Being active can mean we're walking, going for a brisk walk down our street. Being active can mean we are going swimming. Being active can mean you picked up some cans that you had in your pantry, and you're moving your arms, you're moving your legs, you're doing jumping jacks in place. And why am I saying all of this? Because if you can try to factor in 20 minutes a day of just getting your heart rate up and moving, that's going to help prevent from having an inactive lifestyle. Some people spread it out and they do 40 minutes a day, 40 minutes 3 times a week. And that's also a recommendation, and kind of evens out. But it's really how you plan it. But my point is getting your heart rate up, being active doesn't always mean you have to go to the gym, but finding ways to incorporate that. Poor diet, that's kind of also a very broad statement. Poor diet, and really when we're talking about diet, I'd like to point out, we're talking about eating foods that are high in cholesterol, because we talked about how high cholesterol can be a risk factor. And what is high cholesterol? So that's eating fried foods, that's eating processed foods. That's eating foods when you look at your table of contents and it will say cholesterol. When you're seeing really large numbers, and a lot of times we know what those types of things are in, cheese and ice creams, and also really high fatty foods such as red meat. That's all cholesterol. And so also we want to eat foods that are high in good fats. And what are good fats? We want to eat things like avocados. We want to eat things like nuts, even mackerel. Mackerel is a type of fish that has a really good fats. Salmon, and the list really could go on. But my point is, avoiding things that have like a lot of fried kind of fats, and then trying to increase eating things that have good fats, like the avocados I mentioned, and the nuts and the mackerels. And then also another point I want to mention is blood pressure. With blood pressure, we talked about it's a risk factor. So we want to decrease our sodium intake. And what does that mean? We need to avoid adding too much salt to our diet. And salt is really in everything you buy, really in the processed foods, right? And so really the American Heart Association recommends less than 2,500 grams a day, but almost everything that's processed is going to have salt. So somebody had told me, when you shop on the perimeter of the grocery store, because you're going to avoid purchasing some of those processed foods, not all of them, but some. And so that's just a key. Also, afibrillation. Maybe you've heard of this, but it's just a fancy word for a irregular heart rhythm. And it's kind of like a quivering heart. The reason why this is a major risk factor is because it can create blood clots that send off to the brain. And then it causes that blockage or that traffic jam. So it's very important that you are aware of this. There's ways to manage afibrillation. So talk to your provider if this is a concern. And drug use. Any kind of recreational drugs really put you at very high risk for stroke, because there are things that cause certain kind of blood clots to break off from areas of our body, and then they will go to the brain. Also, they can increase the blood pressure just outrageously to where it just puts so much pressure on your arteries, the arteries rupture, and it causes those hemorrhagic strokes, those bleeding strokes, like Sarah mentioned. So we definitely want to stay away from those. And I do see a handful of questions in the chat. So I wanted just to take a moment to answer some of those. And I see Jennifer has a question about, is stress a factor? And I would say yes. We don't list it there, but when we have a high stress level, what do you think our blood pressure does? Goes up, right? Have you ever checked your blood pressure when you're kind of anxious or stressed out? A lot of times when you go to the doctor's office, they call it white coat syndrome. Get your blood pressure checked and it's really high, but normally not that. But yeah, stress is a factor because it does increase our blood pressure. And also Sarah talked about kind of the differences between men and women, having different risk factors and different symptoms. And so I would definitely say stress is a risk factor. And wondered about watching sports, the excitement and disappointments. I think, I think it's really individual, because if you're somebody who already has a baseline, which is like where you live at, if you already have very, very high blood pressure, then there could be a concern that your blood pressure could go even higher, right? But if you're somebody who has you're aware you have a pretty average blood pressure that's healthy, less than 140/90, then I think there's a healthy kind of spike, and your body knows how to regulate that. But I think it's when your blood pressure is already elevated and your body struggles managing it. And so that's kind of important to understand. And is Himalayan salt better? I really honestly don't know the answer to that question. My interpretation is salt, but I think we could look into this, Sarah, and try to find out. I wonder if the American Heart Association has any information on that. And then does that include cannabis? And for cannabis, it's really kind of hard to answer this, because cannabis is used for many reasons for people. Some people use it to keep them calm. Some people use it to help them sleep. It's very medicinal. And so I think the key is, and in the research that we've read, Sarah, a lot of times I don't see that cannabis is listed, right? But I think it's really how you use it. And from my experience and even doing research, most people use it for medicinal purposes to help increase appetite or help relax and sleep. And actually that might be helpful for them to manage their blood pressure. But in correlation to strokes, I haven't seen that research. Okay, I'm going to move on because we're getting close on time. But I wanted to spend time on that because that's probably the key. Those are the key points. And we'll maybe some of this might hit on that, but I just really wanted to spend time on that.
And I just want to add something real quick. Fiber too. Fiber is really important because it helps push through those fats and those debris through your GI tract. I kind of think of it as a broom sweeping all that dirt out. So fiber is also really important in your diet. But great questions.
That's a good point. Thank you. Okay, and so I kind of talked a lot about this already. And so you see it all right there. You see that we want to reduce our eating foods that are really high in cholesterol. So eating heart healthy foods. And Sarah's mentioned fiber. And so really we want to eat fresh foods as much as possible. It's really hard. And I get it, I know. But even eating frozen vegetables over canned vegetables is going to be better because you're avoiding that processed and you're avoiding that salt that's used to preserve. And we talked about increasing physical activity. And then not using tobacco products because that does increase your risk for blood clots. We talked about controlling your blood sugar if you are somebody who is diabetic, but even we should all try to actually eat sugar in moderation, right? But if you are diabetic, managing your blood sugar, if you have diabetes, is going to really help just kind of with how much sugar kind of goes into those arteries. And as we talked about, it can be kind of a sandpaper effect. If conversation has come up about atrial fibrillation, make sure you talk with your doctor about how to manage that. There are certain medications that can help prevent blood clots, but really that's an important conversation to have with your doctor. Next. All right, so we'll just take a quick minute or so, Sarah. As far as medications are very important. Taking your medications to help prevent stroke is very important. And so we just wanted to do a quick little knowledge check, and it's no pressure, something kind of fun. I will just kind of go through these medications, and if anybody wants to kind of share what they think it is, they can say it out loud or you can put it in the chat and we will just go through them. So there's a medication known as metoprolol, and it's also known as low pressor or Toprol. Do we think this medication is a blood thinner? Is it used to manage cholesterol or manage blood pressure? Okay. This is actually used to manage blood pressure. This is a medication that works very good. I see somebody put blood pressure and you're right on with that. It is used. It also can affect the heart rate. So definitely something to keep in mind, that your heart rate can even go a little bit lower. Okay, number 2, atorvastatin, also known as Lipitor. What do we think? Is it a blood thinner? A, B, manage cholesterol, or C, manage blood pressure? I'm seeing number 2 is A. Okay. Well, actually, this one is used to manage cholesterol. This is a very common, and I'm seeing some other answers in there, thank you. It is used to manage cholesterol. This is actually very common. Anyone who's had a stroke will be on this medication, or if your LDL, which is your bad fat, is greater than 70, typically your doctor will have you be on this medication. And we'll go through some more of these. What about aspirin? Blood thinner, manage cholesterol, or blood pressure? Okay. This is a blood thinner. So this is going to make your blood really slippery, and it is going to prevent platelet aggregation, preventing strokes. Simvastatin. Simvastatin is used to manage cholesterol. It kind of ends in that statin sound. So those are used to manage cholesterol. And for the sake of time, I will go through these next couple ones. Lisinopril, and Sarah, if you want to just put on the answers there. Lisinopril is used to manage blood pressure. Warfarin is used to is a blood thinner, also an anticoagulant is another name for it. Clopidogrel, Plavix, is a blood thinner. Amlodipine, Norvasc, is to manage blood pressure. And Rivaroxaban, Xarelto, is a blood thinner, but also known as an anticoagulant. So you might see those medications might be familiar to you, or maybe those are the first times you've heard of them, but we just wanted to go through that. If you can go to the next slide, Sarah. So I kind of talked about our risk factors. Does anyone remember what the #1 risk factor for stroke is? I see cholesterol. That is a really big one, I tell you. But according to the American Heart Association, it's actually high blood pressure greater than 140/90. And why? Because what is a normal blood pressure? And what is considered high blood pressure? So normal blood pressure, less than 140/90. And what is considered high blood pressure is anything over 140/90. So there's kind of an example there, chart. And the big thing with blood pressure is checking your blood pressure every day. If you don't check your blood pressure right now, I really encourage you go out, buy a blood pressure cuff, the one that goes on the arm, check your blood pressure twice a day. And you want to record your blood pressure readings. And then you also want to notify your provider if the blood pressure is over 140/90. Why? Because then you're going to need to have some conversation about how can we work together to get my blood pressure a little bit lower to prevent my risk for stroke, right? So this is a really important chart, and make sure you're checking your blood pressure. And Sarah mentioned it's a very simple, preventable measure. #1 risk factor for stroke. Okay, if you want to go to the next slide, Sarah. And these are just some little tips and tricks. Using the bathroom before you check your blood pressure. Don't run a mile before you check your blood pressure. Really try to relax a couple minutes before you do that. And avoid any caffeine before you check your blood pressure. Next slide. So that's kind of a position that is really optimal to check blood pressure. The blood pressure cuff should really be at heart level and feet flat on the floor, positioned, calm. Next slide, Sarah. And while you're checking the blood pressure, one important thing is no talking because it can alter your blood pressure. And so really just trying to relax, decrease that stimulation so you can get the most accurate blood pressure. Next slide. And something to consider for anyone that's had a stroke is there's a lot of emotional and physical changes. Stroke can be very life altering, and depression is extremely common for patients who've had strokes. And one really important thing that I kind of want to end on is that a stroke can really happen to anyone. You can be young or old. We talked about those risk factors and the modifiable risk factors. And that's what really is so important to understand, because no matter what age, a stroke can happen at any time in a person's lifetime. And so that's why we wanted to come to today, and we want to stand together and really just give you stroke awareness and ways to prevent a stroke. So this is our contact information. You're welcome to write it down, or email us if you have questions. I know we talked about a lot in a very short period of time. An hour is a short time to talk about stroke, but those were the highlights that we really just wanted you to know. So if you're interested in understanding anything further, please reach out to us. We're really open to that. We're support for you and our community. You can reach out to Marlene's and they can connect you. Also, there are some booklets and flyers that we did provide in the chat, and Elizabeth had dropped those in there. So go ahead and take a look at those. And if you have any more questions regarding those, feel free to reach out. But we just thank you so much for your time tonight. We thank you for joining us, and just thank you for listening to our stroke awareness and stroke prevention. A stroke can happen to anyone, anywhere.
Thank you so much, Carmen and Sarah. It was a wonderful presentation. I learned so much, and this is invaluable information that you're bringing to the community, and we are just so grateful and looking forward to having you back with us for 2023.
Thank you so much, Elizabeth, and we look forward to joining you. So we will be in touch.
Definitely. Thank you, everyone. Take good care.
Bye.